Good evening. Welcome to all of you who've joined us this evening. We're here today to discuss the Cosmetic Surgery Board Certification Scheme, to give you an update about that, but also importantly to try and address what's actually true about the scheme and what is not, because there has been some confusion over time, and we have changed the scheme from time to time. So we hope that this report to you is timely, and we look forward to your questions and engagement at the end of our presentation. So first up, I'd like to introduce myself and the group who will be talking to you tonight. My name's Vivian Lees. I'm Vice President at the Royal College of Surgeons of England. I'm former chair of our SAC for plastic surgery, and I work as a plastic surgeon in Wythenshawe Hospital in Manchester. I'm a hand surgeon by daytime on the NHS, and I've had a cosmetic surgery practice throughout this time to date. I've also served as the president of British Society for Surgery of the Hand, and I have been a BARPS council member previously. So I'll hand over to Nigel Mercer.
Thank you, Vivian. I'm Nigel Mercer. I'm a plastic surgeon by training. I'm the lead evaluator for the scheme, and that's something we may touch on a bit later. I've been president of BARPS and of BAPRAS, and also the European Society of Aesthetic Plastic Surgeons. And I was also the first international board member of the Association of, the American Society of Plastic Surgeons as well. So my role is really to look at applications where there may be some issues with them, and all those applications are redacted when they're sent through to me. Thank you.
Hello everyone, I'm Nora Nugent. I'm the current president of the British Association of Aesthetic Plastic Surgeons and of the European Society of Aesthetic Plastic Surgeons. I'm also a plastic surgeon based in the southeast of the UK. I initially had an NHS and private practice based around East Grinstead and Tunbridge Wells, and I'm now in full-time private practice with a focus on aesthetic surgery. And I joined this board as the BAPS representative.
Hello, I'm Jairam Srinivasan. I'm consultant plastic surgeon again. I'm working not very far from Professor Vivian Lees. I'm working in Preston, which is in the northwest of England. I'm a consultant plastic surgeon in the NHS, still full-time. Majority of my work is head and neck and breast cancer reconstruction. But I have my full-time aesthetic practice as well for well over 20 years in the region. My association with the scheme has been in developing the professional behaviors in aesthetic course program, particularly during the COVID, but I was involved in the inception of this course right from the beginning. That's my part, but I'm currently the council member of BAPRAS. That is my representation for this course as well. Thank you.
Hi, I'm Marilyn Howe, and I'm the Cosmetic Surgery Certification Manager at RCS England, and I manage the day-to-day running of the certification scheme. So that includes registrations, applications, and reviewing the application requirements and standards as well.
Thank you. Next slide, please. Next slide. I think it's important to review the background to the scheme and just say a little bit how it all came about. In the early 2010s, we had the PIP breast implant scandal. And following on from that, Sir Bruce Keogh was asked by government to look at how we could bring in regulation for cosmetic interventions and put some proper governance around it. The colleges were approached at that time to see if they could help with that objective, and the Cosmetic Surgery Interspecialty Committee was convened with a series of work streams within it, looking at the different aspects that we were going to have to consider and collate together to make a functioning scheme. Initially, we had some pump prime money for this, which ran out in 2016. And since the scheme actually launched, we have charged for those who wish to certify and get their board certification, and we'll come to that later in the programme. Initially, we convened representatives from across the UK, which included stakeholders from public and private sectors, the surgical specialty associations, and presidents of 2 of these led working groups within the umbrella structure. We had representation from the English Department of Health, the Scottish, Welsh and Northern Ireland governments, also from the GMC and CQC. At this time, it was just the English College, but that developed as an intercollegiate effort. So now the 4 colleges and the relevant specialty associations are all part of this. Next slide, please. So why are we doing this? Well, it's really to respond to the KEO recommendations that there should be some better governance and indeed regulation around cosmetic surgery. At the moment, all that you have to do a cosmetic operation on your fellow citizen is to be on the medical register. You don't even have to be on the specialist register. You don't have to be a consultant. So it is really very open. And of course, we have a regular stream of medical visitors to these shores who also undertake this outside some of the existing structures. So if we have a scheme, then it effectively kite marks those who are competent and willing to demonstrate their engagement with good practice. So from a patient's point of view, it gives them the assurance that if they go to a scheme member, that they will be treated according to the professional behaviours that we have outlined and mandated. The training that this person has received will be appropriate. They will also be able to demonstrate experience, and there is an experiential element in the boards. All of this together should give them a level of safety that they may not always get elsewhere. From the surgeon's point of view, this recognises you as a cosmetic specialist in your particular field. Effectively, you earn the kite mark, and this will help you with appropriately and positively promoting your practice. It also will help you, in some hospitals at least, with getting admitting privileges to your private hospital. Next slide, please. I'll hand on to Nigel.
Thank you, Vivian. So one of the big myths about cosmetic surgery is that only plastic surgeons can do it. And for many years, BARPS in particular has felt that's not appropriate. We learn a lot from ENT colleagues who do rhinoplasty, oculoplastic surgeons who do excellent oculoplastic work, etc., etc., etc. So the reality is it's open to all surgeons who are practicing in cosmetic surgery who are on the GMC or the Irish Medical College, the Irish Medical Register under the relevant surgical specialty. And you apply for certificates that reflect the level of your practice. And this has been discussed over many years, and it's felt by quite a number of people that the original spread of the certificates didn't reflect the level of practice, and so there's been a lot of work over some time to try to make the certificates reflect those areas of practice which are mostly anatomically based. Next slide, please. So this is really, as I've said before, basically we would want people who practice to a level that would allow them to qualify for the individual certificates if they're going to be plastic surgeons, who can then apply for the cosmetic surgery certificate, which is an overarching certificate for those who are practice trained and can demonstrate their abilities within the whole gamut of cosmetic surgery. For those plastic surgeons who don't perform facial surgery, rhinoplasty, breast surgery, abdominal surgery, body contouring, etc., we recommend they apply for the individual certificates, and you can apply for additional certificates as time goes by at no extra cost. So it doesn't debar you from going for more certificates as your experience increases, and indeed as your practice changes. All you have to do is submit an updated numbers counter, which is part of the application process. Next slide, please. So one of the major myths is that the application will be denied if it's felt that I don't fully meet the requirements after my submission. Please don't have that impression. That is not the case. If the evaluation team feels you do not fully meet the requirements in some of the areas, we will discuss that with you. That's a very open process, and we will recommend pausing the application potentially, so you have an extra 2 years to increase your experience and to resubmit new and additional evidence at no extra cost. So it's not a door opening and a door closing. We do our very best to try to encourage people to come to the point where they're fully certificated in various areas, and we try to make it as unonerous as possible. Next slide, please. So this is similar to the last slide, that if you basically we have to recertificate every 5 years, which matches in with revalidation. But you don't have to wait until you are recertificated at that 5-year point to apply for additional certificates. As I said, as your experience increases, you can apply for those additional certificates prior to recertification at no cost. And basically, you have to submit an updated numbers counter, as I've mentioned. The other thing is you can step away from certificates if you feel they're no longer part of your practice. The whole idea of the certificates is really to provide a safety level which we've never had before for the patients, who know who is doing what and who has a good level of expertise, training and experience in particular areas. Next slide, please. Hand over to Nora now.
So I'm going to talk through the different routes to certification, because there are a few different pathways, as you can see from this slide. The following slide shows a flow chart that we will pause on for a few seconds for you to digest after I've gone through it. But certification started with the traditional route, where the requirements were to be on the GMC or Irish Medical Council Specialist Register in the relevant specialty. And that's plastic surgery for the overarching cosmetic surgery certification, general surgery with a special interest in breast surgery for breast surgery, ophthalmology for oculoplastics, ENT or maxillofacial for some aspect for facial surgery, and so on. It is open to anyone in cosmetic surgical practice, and it is still open even though there are the other two routes below as well. You have to meet the operation numbers, complete the professional behaviours in aesthetic surgery course, complete the online application, and we recommend that you have a minimum of 1 year experience in private cosmetic and aesthetic practice, and look at all the requirements above before submitting an application. And this route is open. We have, however, recognised that there are some already very experienced surgeons in the UK who have already shown themselves to have more experience than everybody else necessarily going down the traditional route. So there has been an established practitioner route created as well. You still have to be on the specialist register in a relevant specialty to the certificate that you are applying. You still have to submit operation numbers and complete the professional behaviours in aesthetic surgery course. But if you also have full membership of a relevant UK professional association and more than 3 years experience in cosmetic or aesthetic surgical practice, then you can be eligible for the slightly quicker established practitioner route. And there are a lot of people already eligible for this route who have not taken it up so far. So I would encourage you, if you meet these criteria, to look at going down the established practitioner route. And then finally, we are introducing a new route called the mentored route. And this has really arisen out of the potential creation of a chicken and egg situation for newer plastic surgeons who have just come off the end of training, completed their CCT, fully qualified plastic surgeons, ophthalmic surgeons, and so on, but haven't yet got the required experience to complete the traditional or established practitioner route. With some hospitals, particularly now, looking at certification as a requirement for admitting or practicing privileges, potentially this group can fall between the stools of not having enough experience to get certification, but not being able to get the experience to become certified. And we've also recognized the value of mentorship in the early years of practice. So it isn't just about making yourself eligible for practicing privileges. It's also about recognizing the value of mentorship in the early years of consultant practice, particularly in the private sector, where traditionally it's more isolated practice and less supported than in the public sector, where you're part of a much bigger team. And it, as I said, it's aimed at new CCT holders who don't yet have the numbers or experience to go down the other routes. And it allows them to develop their practice and experience and numbers in a sort of supported, safe way. We would appoint an approved mentor, and it shows commitment to achieve certification as well. And we are piloting this scheme at the moment, and we would look for newly appointed CCT holders to participate in the pilot, and we will also obviously be looking for experienced mentors as well. So this is a new route that wasn't previously available that we are hoping to launch very shortly. Next slide, please. This slide is the flow chart of what I've said on the previous slide. So I will go over it and then I'll pause, as this would be a useful chart to take a screenshot or a photograph of. And first of all, are you an established consultant with more than 3 years experience in cosmetic surgery in the private sector? If the answer is no, are you a newly appointed CCT or CCST holder? If it's no, then you have to go down the traditional route, and the eligibility criteria are the specialist registration in a relevant specialty. When you're applying, we will look for probity statements, evidence of indemnity, completion of the professional behaviours course, revalidation, or in the case of Irish candidates, annual Irish Medical Council registration, operation numbers, evidence of clinical outcomes and case discussions, complications with reflection on your practice, and references. Then you submit your application. It will be evaluated and bring you towards full certification. If you are a newly appointed CCT or CCST holder, you can also go down the mentored certification route now. It again requires eligibility for the specialist registration. You complete an application form and the professional behaviours in aesthetic surgery course, and you will participate in a mentorship programme with a confirmed mentor who will provide regular report. When you have gained enough experience and completed the mentorship, then you are eligible to apply for full certification, either by the traditional route, which I've just described, or down the established practitioner route. For those of you who already have experience, who are on the specialist register in a relevant specialty, and who also hold full membership of a relevant UK professional association, you are eligible for the quicker established practitioner application route. For that, we require an application form, the operation numbers, and completion of the professional behaviours in aesthetic surgery course. At that stage, you can then submit your application. It will be evaluated, and if approved, you will achieve full certification. Nigel has already talked you through the approval process and numbers and so on. We're just going to pause on this slide to give everyone a chance to digest it and take a screenshot if they need to, and before we move on to the next part. So we'll just pause for a few seconds. And next slide, please.
Vivian, I think you're muted.
Sorry, Vivian.
Addressing the benefits of board certification, we do expect that regulation or legislation will come in at some point in future. We had originally worked with the GMC towards making a credential, and you may have heard of this, but the GMC has decided that none of its credentials are going to proceed, even those that it had already passed, which were no longer funded. So that project has ceased, and we've become the boards of cosmetic surgery and will be working with the Department of Health. There's certainly regulation coming down the line for non-surgical practice, which represents 90% or so financially of the cosmetic market. And we are partnering with the JCCP, who advise government on this, to try and make sure that we align what we're doing with what they are doing. By having the board's certification, you show commitment to the best practice, you're helping surgeons to come to the right group of people, and overall, you're helping make cosmetic and aesthetic surgery safer. The list of those who are on the board's programme will be available publicly, currently via the college website, but there may be alternatives to that in future. And you have demonstrated thereby your expertise as a board-certified cosmetic surgeon with the necessary experience. Next slide, please. I'll hand over to you, Srinivas.
Thank you, Vivian. I'm waiting for the slides to change. While we are changing it, I understand that there are some colleagues who are struggling to join in. I've been getting messages as we go on saying that the link is not available. I hope people are able to join in numbers now with links being uploaded. Can we go to next slide, please?
I think you're on the right slide there with the course.
I'm still looking at the flowchart that Nora finished off a moment, so I need to move to the next slide to talk about the cost and fees and everything else. So while we are doing it, Marilyn, there we are. They're reloading it. While they're doing it, Marilyn, can I just clarify one thing? One advantage that we probably need to highlight here. The established practitioner route, the bigger advantage for them is that during their professional behavior courses, they don't need to do as many reflections as the standard route do. That was the biggest advantage for people in established route pathway. It's a shorter process. It still needs a meeting at the end, but they don't need as many reflection points as the traditional route colleagues need to do. So, as Nora said, for people who are eligible but haven't applied, it's a good chance to do that through established practitioner route because it'll be a quicker process and easier, more enjoyable in that sense. Okay, sorry, we come back now. Thank you. So coming back to the professional behaviors in aesthetic surgery course, as you saw in every route that we went through, it's a requirement in addition to the application that one must have completed this so-called PBAS course. This was developed to establish a certain set of standards that anyone who is practicing aesthetic surgery within our country to adhere to as a basic standards, both in governance as well as how to market oneself how to look after the patients. So this went through a very widely involved discussion among various topics on the very established colleagues to newer colleagues, and a lot of consultation process led to development of learning modules as listed here, mainly talking about the standards in aesthetic surgery, how the patient should be received and supported in the process, how safely you can market, because marketing is recognized as an essential part of aesthetic surgery, but we shouldn't fall foul of the marketing regulations in this country, be seen to be giving incentives or shortcuts or reductions and anything else. So we need to adhere to the rule that is available in our country, and we need to stick within that. Marketing itself is not a problem, but how you deal with it, how to impart information, those areas were addressed in this course. And as a consultant journey who go through the processes, looking after patient, what happens if you are not in the country? How do you hand over the care of your patient to between your colleagues? So it generally fosters a safe practice for the clinician as well as for the patient. That's where the focus of the professional behaviors in aesthetic surgery course is aimed at. Finally, people who finish that, they have opportunity to record their reflections, and then they are invited to attend a virtual discussion forum where it is managed by one of the tutors and possibly 4 to 6 typically colleagues joining in as an open discussion of things that I have learned, things they want to discuss. And almost invariably, everyone who came to these courses, they felt it is more valuable because they learned something that can adapt in their practice. So I'll go back again. The focus is on safety. It is not more, let's make it burdensome, but there are always points to learn. And as standards change and evolve in every few years, it is best to keep updated on that. Next slide, please. So the fees for all of these courses are as explained here. So it may be worth again taking a screenshot of this for those who are willing to apply. The application fee for the certification is, as explained, £650 for all the routes in a way. Professional behaviors in aesthetic surgery is a separate fee. That again, we decided to keep those things at a lower, affordable cost for many people compared to what used to be face-to-face course over a 2-day costing well over a couple of £100,000. So we had to make it affordable and easy for people to do that. The recertification that is recommended once in 5 years from the original certification is again kept as nominally at £250, partly to go through the records and processes, but partly to encourage people that the recertification hopefully will be in sync with the recertification from the GMC point of view. Revalidation, sorry. The provisional certification, as you can see, is again the same fee but split in 2 parts. Applicants can pay $325 in the beginning, and then they finish the remaining part at the point of final submission. So there is no additional fee. What you see here is exactly what it is. There is a standard fee for all the courses, but it is separate from the professional behaviors course, which is a one-off that you need to attend. So all these details are available on the link, as you can see. So please, if it is useful, take a screenshot of that. Thank you. Next slide, please.
So what about the future? We have recently changed the name of the scheme to the Board Certification Scheme, as I've explained earlier. And the committee that oversees this is called the Intercollegiate Cosmetic Surgery Board, and that reports directly to the joint surgical colleges. We've developed a new brand for the scheme, and shortly we will be able to show you our new logo, which you'll be able to use with your letterheads if you're suitably certified. I'm afraid we couldn't get that through for you this evening, though, so you'll just have to hold your breath on that one. The regulation will no doubt change with the GMC, also with the CQC, who've approached us just recently, and we are in active dialogue with the Department of Health about all of this as well. And as I said before, working alongside the JCCP just a word, if I may, on non-surgical regulation. The proposal that's been considered is developing something like a traffic light system. So green, amber, red for England and Wales, and probably 1, 2, 3 in Scotland. That process is just getting underway now, but is fully otherwise reported to government in this country. And the idea would be that suitably trained beauticians could do some non-cosmetic interventions. So those would be labelled green. The amber would represent people who were in a CQC regulated facility. It's the Environmental Health Office that looks after the beauticians on the high street. And the amber procedures would be for nurse practitioners and other associated professionals who are suitably trained for that. And then the red procedures would be for surgeons, some, dental practitioners as well, dental surgeons. And those would have to also take place in a CQC regulated facility, be that a clinic or a hospital. The licensing scheme hasn't happened yet. We think it will before too much longer, and we're waiting to hear about that. This would happen by secondary legislation, because the Health and Social Care Act that went through about 3 years ago actually provided for non-surgical licensing to then take place by secondary legislation. That means it doesn't have to go in front of Parliament and the MPs to debate again. Surgery is not provided for in this scheme, but that is a discussion that we will continue to develop, and we would like to be part of this simple identification system that would help patients. I mean, some of the things that are going on out there at the moment, you may have read in the press, but they are absolutely heart-wrenching, what people are being put through in believing in all faith that the system will look after them. But unfortunately, the regulation is simply not there to do so. And that's what we're all about here, to try and show our best practice in a simple way to the public. So that really, I think, brings us to the end of the main presentation. So I think the next slide is for any questions. So we have some of these coming up. Just for a minute. Now, Marilyn is going to talk us through some of the things that she gets asked again and again. So we'll start off with those questions, if we may, Marilyn.
Good evening, everyone. I'm Marilyn Howe. I'm the Cosmetic Surgery Certification Manager. I deal with the day-to-day application. So I'd probably be the person you would deal with the most during your registration and application process. So some of the questions that I get asked quite regularly is, does everyone need to complete the PBAS course, known as the Professional Behaviours in Aesthetic Surgery course? Simple answer is yes. So whether you apply via the traditional routes or the established practitioner route, you are required to complete this course. And just to clarify, the course is only one component of the application process. Sometimes on occasions we have received people who've completed the PBAS course, which is great, but they are under the impression that's the complete certification for the application process. So you do your course and you also have to do your online application, whether that be the traditional route or established practitioner route. Another question is about the operation numbers and what do you need to provide? Well, that really depends on what certificate that you're applying for. So we have a minimum number of overall procedures per certificate. And within that certificate, we have specific procedures within those areas that you need minimum numbers for. So, for example, if you apply for the cosmetic nasal surgery certificates, you need a minimum of 30 procedures overall, as well as a minimum of 10 rhinoplasty procedures that were independently performed. Now, the time frame on this is 10 years. So you can go back 10 years over your practice. You can go back less if you wish to, but that's the time frame that we have for the numbers that you can provide. We also are asked sometimes, is the application fee annual? So the £650 application fee is not annual. That's just the application fee for your certification. However, as mentioned before in this presentation, every 5 years from the date that you originally received your certification, you are asked to recertify. You don't need to go through the whole application process again, but you are asked to provide evidence of your GMC revalidation, your appraisal, highlighting CPD activities specifically related to your aesthetic practice. And the fee for recertification is £250. And Nigel, I think, mentioned this earlier. Can I add additional certificates after I certify? Again, the answer is yes. All we need to see is your updated operation numbers for the additional certificate that you wish to add on in the future. And I'll pause there because I'm sure there'll be other questions that are coming in. Thank you.
Thank you, Marilyn. Yes, we do indeed have a few questions. So I have one here. What happens if somebody is not on the specialist register? Are they able to do the scheme? Now, we've thought very carefully about this over a long period of time, but we've always come back to saying that we believe the CCT and the CSER are absolutely the foundation of what we then build on doing this scheme. And without that, we don't think people have the foundational knowledge and clinical skills and operative experience to actually credibly be part of this scheme. Now, that is not to be excluding people because it's open to everybody, particularly now the GMC has opened up the CSER application route to give many more options about how you can get your CSER. So if you really want to do this, but you don't have that certification, then you need to get your CCT or your CSER. And we feel that that's the right thing. That's just the position that we've taken about that. And we're not in the business of regulating people who are outside that cohort. We want to show the best practice by going through this pathway. We believe in it. So, Srinivas.
No, Vivian, I wanted to raise the point that people keep asking many a time when we talk about the point raised by Professor Ajay Mahajan in the chat box. Ajay is a plastic surgeon and a long-standing colleague and a friend. So he raises a point that he does not want to sound negative, but can anyone tell me as to what is being done to certify practitioners who are not on the specialist register of any specialty and do not have any body regulating their practice? So basically the so-called cosmetic cowboys, what do? You are very clear in stating people who are on the register can apply for it. That route is clear. But what about people who are not in the specialty, but they are still doing? How to regulate them is question.
Well, if they're not in a relevant specialty, then we don't think they should be doing that. So it's not our position to provide regulation for those people. we believe in the standard that we've set, and we think this is the way to demonstrate the standard. We can't replicate a whole standard setting and accreditation system just to deal with that cohort. But of course, you know, that there are people who practice, some of them I acknowledge do practice very well, but that scheme is not about dealing with that, you know, that heterogeneity of where people have come from. But I will say that the CSER route, for those who've worked in the NHS, is a very flexible option. And increasingly, I think a lot of people will do CSER. The specialist register is also acknowledging those who come from a European country and are automatically recognised. Whether that will continue in future is not clear. It was due for review at the new year, and I have yet to hear about that.
We all know, sadly, that there have been sorry, Nigel, sorry, just finish this one. We all know, sadly, that there have been a few deaths for people who go overseas for so-called cosmetic tourism that raised the general public awareness of a regulated and a well standardized practice that happens in the UK. And I hope that will increase the awareness of people to look for some certification scheme like a kite mark, which will then possibly be a driver for people to do accreditation in a way that is safe for the patients. Sorry, Nigel.
And if I may come on that, from the very outset, all the discussions really centered around not so much performing the cosmetic procedure itself, it's dealing with the complications thereof. Because in this country, you're a lone surgeon working with no one around you, and patients do need to, I think, have that. We all felt should have the assurance that the individual who was looking after them knew how to diagnose and treat compartment syndrome, all the other complications that can be associated with surgery. And this is one way of doing it. The change to board certified, I think, is very important, because some cosmetic surgeons in the UK are doing courses in the States and joining what are basically board certified schemes in the USA, and are advertising that in the UK as if they are certified in the UK. And so the important thing about this certification scheme, it is the only one that is approved by the 4 surgical colleges of the United Kingdom and Ireland. And remember that if you are in the Republic of Ireland, you can apply for it, and that certificate applies only to Ireland. The GMC certificate only applies to working in the United Kingdom and Northern Ireland, not in the Republic. But this allows established cosmetic surgeons who are certificated to then say proudly, I would really hope, that they are the first board certified cosmetic surgeons in the country. In fact, the first board certified surgeons in the United Kingdom. So I think that levels the playing field for those who are appropriately trained against those who aren't appropriately trained. And then there will need to be messaging to the public about what that particular difference is, because it is a very significant difference. Thank you.
Thank you. So I have another question here. What if I, as a plastic surgeon on the specialist register, have been undecided about cosmetic surgery, but would now like to do this and have fallen through the gap with the mentorship programme? How can I proceed? Is there still a way to do that? And I'm taking it that our questioner is a consultant and has perhaps been in practice for a few years. So Nora, can I ask you to address that one?
Yes. So actually, the mentorship scheme is meant to address the group of people who are fully qualified in terms of CCT and specialist registration, but don't have the numbers or the experience to go straight to full certification. And if you can meet those criteria, then the mentorship scheme will be a good way of going forward, because it provides you with the support when you start off in cosmetic surgery practice. Ultimately, you will still need to show the numbers and the experience and complete the professional behaviours class and so on, but you can do it through a more supported way by undertaking the mentorship scheme. This mentorship scheme is just launching, and we're looking to start a pilot for it. So I guess the first route would be via the pilot scheme, but we would hope that this would become a good route for new participants for aesthetic surgery who are meeting the basic foundational criteria of being on the specialist registrar in the relevant specialty, and obviously to get that having completed either a CCT or CSER route. So there is still a route forward in cosmetic surgery, but in a more supported way, and perhaps over a longer period of time to gain the experience to get full certification, or as via the compared to the established or the traditional practitioner route. Nigel.
Thank you. Following on from what Nora said, when we look at applications, we do look at the numbers counters, and you, as I think Marilyn said, there are a number you have to perform yourself. You can get credits for things that you've been assisted through, and also that you've observed. Now, obviously, it would make little sense to certificate someone who's seen 50 cases but only ever done one themselves. But it doesn't stop you actually being awarded the certificate. What we would do in that situation is each one is assessed individually. If someone's experience is, for example, they haven't done, say, a rhinoplasty for cosmetic rhinoplasty for some time, but they've got lots of reconstructive rhinoplasties, then we would be suggesting that they work with a mentor. This is not just in the mentorship, the young mentorship scheme. This is even throughout your career. If your experience lapses, we would ask you to go and just observe and work with a trusted colleague who can get you back up to speed, and that you show your CPD for that. So we've tried to make this, what we've done with the mentorship scheme is, if you like, extend it downwards, as it was there beforehand, because we do want people to be starred on the scheme, which shows your main areas of practice, where they're current and they're up to date. And there are ways of checking that when people submit their information, and I hope we do it in a very sensitive way. I think there is another question about gynecomastia, which is probably worthwhile covering off in a moment, but I'll wait for Vivian to come back onto that. Thank you.
Thank you. So the question is about having applied as a breast surgeon on the established practitioner route, clearly very experienced, but just happens within the cosmetic procedures that are routinely undertaken not to do gynecomastia, and that is one of the things that's on our list that you do need to include. So how do we deal with the fact that not just this certificate, but perhaps with various certificates, there may be just one procedure that you don't do, and yet it's essential as listed? I wonder if you have a comment, Marilyn, because this has happened several times in your experience.
So yes, we do recognise that that's quite a niche procedure, and normally we can't just make a decision whilst we're evaluating it. So what we normally do is we take it to our board meeting, and it's discussed at our board meeting, and then we take it from there. Really, we hear from all board members, and if we feel that actually this is a niche procedure, we might recategorize that procedure within the operation numbers counter. So instead of saying it needs to be 10 performed, we might say actually it could be 5 performed as assisted, or 5 observed, or it may be that you don't need a minimum requirement for it, or the idea is that you do, but if you don't, you'll still be certificated under the cosmetic breast surgery certificate, but you might not have that particular, well, you wouldn't have that particular procedure listed under the areas that you predominantly practice on the public register. So normally what we would do is we would take it to the board, have a discussion, and look at potentially recategorizing that. Once we do, then we would get back to the applicant and let them know. And then that would be made live for all other applicants as well who want to apply for those particular certificates.
Thank you very much. Are there any other questions around that? I think there was another question about exactly how do you apply for the mentorship program. And as was mentioned earlier, this is in pilot at the moment. But the plan would be, if we've got our group of mentors up and running, that we would help match the applicant who wanted to be on the mentorship side with somebody who was suitable and agreeable to them. Srinivas.
Can I just raise a parallel point here, Vivian, if that's okay? Because some colleagues who are established practitioners who would like to be mentors, do they have to register with the English College recently opened the mentorship program to be accepted this? That's the one question.
No,
Second is,
sorry, shall I just take that one? And then the mentorship scheme is across all specialties, and the English College launched that last week. So a lot of work's gone into that. But for the purposes of the cosmetic boards, we are intercollegiate. So we would get any mentor from any college who'd otherwise previously engaged with us to be badged. So that's not a problem.
thank you. That's very, very good clarification because that scheme launched in English College, but I'm an Edinburgh College fellow. So like me, other college fellows are wondering how can we part of this program. That's good to know. The second part to that question was when somebody wants to be a mentor, the question was raised how the indemnity providers will support them. Would they charge them more or less? But I had informal discussion with some of the insurance companies, indemnifiers. They are open to support the process. So therefore, there is some support coming up as a mentor. The final focus is to provide a safe practice for the surgeon, for the patient in our country. That's the main thing. So if we come together, that being a prime focus, I think we should be able to work together with insurance companies as well as among colleagues to provide that as a final outcome.
Yes, we do welcome the involvement of the insurance companies. It would be wonderful to have them on board. A related question, does the mentor need to be certified themselves? Now, in the first instance, we are going out to all of our previously certified surgeons to encourage them to be the mentors. So at the moment, yes, that's exactly the plan, because I do think that you need to walk the walk if you're then going to oversee somebody else doing this. I think that's only right. And if you're still in active practice, we'd encourage you to actually do the certificate yourself and then become a mentor. So very much looking for senior members of the profession to set the example. Marilyn.
I just wanted to quickly say that anybody who is on the webinar at the moment who is interested in joining the Mentored Certification Route pilot, please feel free to email me at the help desk email. I think it was on the final slide, but it's apply@certify-cosmeticsurgery.org.uk. I will pop it in the chat as well, the email address. Thank you.
An important question here, what would mentorship involve? Now, I think we might be able to put a link into the chat that would take you to the relevant part of the website, because it's actually a very big answer that will be needed, and we're going to run out of time on that one. But clearly, mentorship means different things in different contexts to different groups. So it does need to be defined. And we'll probably answer that question a bit better once we've run the pilot. And I think we could well do with another webinar at this stage. So Eduardo's kindly put up some links there for you. And then an important question about procedures done in an NHS setting which are done for reconstructive purposes but have crossover skills. Would they help count for the numbers? And the answer is definitely yes. So a therapeutic mammoplasty on one side as part of a DEP reconstruction, yes, the breast reduction would count. Absolutely. But you can't have all of your procedures as reconstructive crossover procedures. When you look at the count, you will see how many of those you're allowed to include. So have I missed anything to my panel? Nora?
I don't think you've missed any questions. I think we've worked our way through. But just coming back to mentorship, there are a few versions of mentorship launching recently. So it's just I think it was worth just clarifying. As you said, the English College launched a mentorship scheme. For certification, we're launching a pilot mentored route. BOP's also run an aesthetic surgery mentorship, which is different again. It's sort of a crossover between a fellowship and continued mentoring support afterwards as well, but that's separate from certification mentorship. And there are other mentorship titles in other fields as well. So it's just, I think it's important to be clear about which mentorship applies to this, because it's easy to get confused when people are getting messages about different mentorship schemes.
Srinivas.
Sorry, Vivian. On the same clarification that you mentioned to Sarma Tamimi's question, that things that are done which is part of reconstructive procedures can be partly counted towards the total count. Many people who go through the standard training program in the UK who are coming up to CCT would have accumulated similar processes of numbers in reconstructive procedures in their training. So they can count towards their mentored scheme that will add up to the numbers as well. Same example that's been given as a DIAP reconstruction, contralateral breast reduction, will add up some numbers towards the required total numbers for certification. So newly qualified trainees can also take some numbers into that application process from their NHS training.
So I think that probably is all the questions that people have wanted to ask this evening. I very much hope the session has been useful to you, and obviously those of you who've joined tonight and given your time, I hope that that's answered some of the questions that you've had and perhaps put to rest some of the misconceptions you've had about the scheme. So we're here to support you. We'd like to make sure that you're able to successfully complete it. It's not about excluding people, as long as you meet the criteria. And you've got some links up there, which will be helpful if you need to find out a bit more. And Marilyn is our contact person par excellence for all of your queries, and will be hugely supportive to you. I'm very grateful to Marilyn for all that she does. For Karen, who supports us under professional behaviours, and for all of my panel members who've been huge supporters of the scheme and done so much to make it a reality. I would like to thank you very much. So that brings us to the end of the session, and we look forward to seeing you in future.
Thank you.
Cheerio. Bye-bye.
Thank you.
Thank you. Thank you.